Okay, let's have a class. And before we move on to a new infectious disease, let's just do a review what we have, what we talked about so far. Okay, so the class what we started to talk about respiratory tract pathogen. So you can say this is a upper respiratory URT. We call it a URT pathogen. Now, what are they? What we talk about? The first one right here, you see, diphtheria. They're called Corynebacteria diphtheria. Now, what's toxin? Of course, it's a diphtheria toxin. Okay, now at the beginning when we learn, of course, you need to know what we already talked about, the gram stain. So this is a gram positive. Is that right? Large shape and club arrangement. Okay, then we talk about what type of the disease it's going to be looks like. Now you see this slide, we mentioned the ball neck. Of course, that's a lymphonoid swelling. So that's swelling. Lymphonoid. And what you see, the tonsil, pseudo membrane, pseudo membrane in the tonsil area. Now, we always remember this is shouldn't be an issue in the United States because we have a vaccine called the DTaP. What are they? Diphtheria, Clostridium tetani. We're going to talk today. Baculosis pertussis. And this is the one need multiple booster shots. What is their toxin? That is called AB toxin. So we have a toxin domain and a transmembrane domain cause bleeding, cause inflammation. That's easy for you. Okay, that's the first one. Then we talk about a big disease which is related to the brain membrane system. We call it is meningitis. So meningitis, we mentioned several pathogens will cause meningitis, and it is age dependent. So 0 to 2 months, what we say, we call it a GBS, which is group B, Streptococcus agalactiae. And we mentioned about what we call as a group B. This is Rebecca Lansfield group classification or grouping based on antibody-antigen reaction, serological typing. We could group lots of the Streptococcus into the group. And that is group B. Group A is Streptococcus pyogenes. Now some of the bacteria cannot do grouping, even their Streptococcus, because it's rely on the M protein in the cell membrane system. Okay, how about like 2 months to 5 years old? We call it HIB. That is type B Haemophilus influenza. And this is what we call #1 childhood disease in the United States. It's responsible for more than 80% of the meningitis in the United States. It is also very special, a fastidious bacteria. Once we call it a fastidious bacteria, what we talk about, they only grow on chocolate agar. The brownish color agar looks like a chocolate, but it is not a chocolate. There's no chocolate ingredients. And we also see very special. They need X and V factor to grow. Look at here. Once you have X and V factor, they start to grow. And it's also grow very uniquely, are very tiny dots on the blood agar, but surrounded with staphylococcus. That's called satellite phenomenon. So it's a very special one. Of course, it's a coccobacillus. How about 5 to 40 years old? That's adults. We call this is Neisseria meningitis. Now, Neisseria meningitis, if we want to talk about education, general education, this is important for undergraduate. Because undergraduate, in the crowded area, in the dorm, or even in the bar or library, I'm talking about like downtown library, not our Evansdale library is a little bit quiet. It's going to be a risk there. It is very easy to be diagnosed if we have the picture, or we say using staining technology, because the pathogen looks like what? Coffee bean shape. And it's a diprococcyl, gram-negative diprococcyl coffee bean shape. And the serological typing A, B, C, Y, W 135. The serological type B responsible for 60% in the United States. So in the history, it is very difficult to generate a vaccine. Until 2010, we successfully have a vaccine could be cover serological type B. So that's Neisseria meningitis. How about the next one? If it's more than 40 years old, we call it older people, we get Streptococcus pneumoniae. That is, we call number 1 community-acquired pneumonia. So number 1 CAP. Okay, the next one what we talk about is Bacteria pertussis. That's P what it means, is pertussis. So pertussis, what's the characteristics for the pathogen? It's gram-negative coffee bean, gram-negative coccobacillus. It looks like similar. It's also AB toxin, but very special. This will cause whooping cough, which means very productive cough with respiratory tract gasp. And typically for the newborn baby after 100 days born. So some country call it 100-day cough. But we have a vaccine for that, it's DTaP. And very unique for the diagnosis, we using nasal swab. The nasal pharyngeal swab and using PCR methods to testing the pathogen. This is important. We talk about the blood agar is a differentiated media, alpha beta hemolytic. Then we move on to a very important one, Streptococcus pneumoniae. We mentioned about here. This is a diprococcyl. The diprococcyl, it's a number 1 community-acquired pneumonia, so we have fever, chest pain, and cough. Now, in order to differentiate with normal streptococcus in the oral cavity, we're using P-disc. Because you can see Streptococcus pneumoniae is susceptible and the other Streptococcus is resistant. So that's why you see lots of the bacteria surrounding the opticant, which is a component in the P-disc. So that's Streptococcus pneumoniae. Klebsiella pneumonia, when you see it's Klebsiella pneumonia, what's special? And we said this is only 1% pneumonia in the United States, although we call Klebsiella pneumonia. The species name is pneumonia. But more special, when you see the colony, it is mucoid colony. It looks like cheese-like. Why? Because of the heavy capsule. Result is that. And look at the blood agar, the cheese-like, very sticky, and on here you see the pink colony because of lactose fermentation positive. Streptococcus pyogenes. Comes out with a big one. We call GAS. So that's Streptococcus pyogenes. Streptococcus pyogenes, what is very special? This is called strep throat. But we know that the strep throat is a very invasive result. At the beginning, you have the surface contamination. We call it impetigo and cellulitis. And then, even if we recover, we still have some sequela. We call it sequela, or post-streptococcal disease, glomerulonephritis and rheumatic fever. Fever with a joint pain. And that's a big picture, very good one for strep throat. Okay, group B, I think did we mention about a disc? Okay, we didn't mention about that. GBS. Okay, we already talked about that. So very important, we want to talk about GBS, group B streptococcus. We mentioned here in the review, this is responsible for the newborn streptococcus. Sorry, the newborn meningitis, called Streptococcus agalactiae. So, what we can do, the newborn baby basically barely we do treatment unless it's life-threatening situation. But what we can do is for the pregnant woman. So, for this pathogen, for GBS, it is usually suggested pregnant woman at 35 to 37 weeks to do a screening test for GBS. If it's tested positive, you need to use antibiotics immediately. Of course, it's a pregnant woman approved to be used, fit to be used. Otherwise, the newborn baby will have meningitis, bacteremia, or septicemia. So, this screening test is important. Lots of the case in the United States, the newborn has meningitis because the woman doing the home delivery did not have a check off with GB all the time. So that's why it comes out with results. If you do that often, it should be fine. Now, how we differentiate different streptococcus, especially with group B and the group A, we using a different disc. This is called the A disc. So the A disc, we split them into two. Left side, if we grow Streptococcus agalactiae, it is resistant, which means they can grow. On the right side, if we put Streptococcus pyogenes, it's not grow, and this is transparent zone. That means it's susceptible, or we can say sensitive. The reason is the A disc, they have antibiotics, is called bacitracin. We're going to mention this bacitracin again, okay? So, remember, differentiate Streptococcus pneumoniae versus viridine strep. We're using P disc. The component is called opticam. if we want to differentiate Streptococcus pyogenes with group B Streptococcus, we're using A disc, and the A disc, the component is called bacitracin. So not many we want to talk about. Okay, let's talk about the Staphylococcus. This is something little different, but it's also easy to talk. Even we have a couple of slides, but it's easy to understanding. And then we're going to talk about how we differentiate Staphylococcus and Streptococcus. Okay, Staphylococcus. And this is what we talk already, Streptococcus. Both of these two bacteria is gram-positive. This is also gram-positive, which means you do gram-stem, it's purple. No difference. And both of these are coccell. So round shape. No difference. What is the major difference? Is arrangement. Staphylococcus is grape shape. Looks like this. And Streptococcus is chain. Looks like that. But I want to mention is that if you get a sample from the patient in the real life, that is not very easy to differentiate. Because the chain, they could be like this. That's also a chain. The grape shape could be more organized. So what we do? We do a very easy test. It's called a catalyst test. It's a biochemistry test. The catalyst test is very interesting. What I want to introduce to you. Basically, you put the bacteria on the glass slides. You are pumping hydrogen peroxide. If one thing is bubbling, that is positive. And very beautiful, like boring. Now, often the time what we see, Staphylococcus is bubbling. That is positive. And Streptococcus, there's no bubble. So that is negative. Which means if you knows one way or the other, catalyst test, dripping hydrogen peroxide will severely help you for that. What's the story behind that is H2O2 could be hydrolyzed, become water, and with bubbling, that is oxygen. The oxygen is bubbling. Now, we already talked about Streptococcus. We want to talk about Staphylococcus. And we want to make it a little simple. Number one, Staphylococcus we call epidermis. Okay, what is epidermis means? What means epidermis? On the skin surface. So this is usually we call, it's a normal bacteria on skin surface. That's Staphylococcus epidermis. We shouldn't worry too much about that. Number one. Number two, Staphylococcus saprophyticus. Staphylococcus saprophyticus is a sexually transmitted disease pathogen. We give them a nickname called honeymoon bacteria. Why? This is usually for the woman at 25, 27 years old and sexual activity. So, very easy a joke story is if the mom see her daughter, one day told her, I'm not very comfortable with my lower body, and it's itching and a little discharged, and they go to see a nurse. The nurse will say, come to my office, and close the door, will say what she did for these days. Did she not at home for the night? If the mom can suddenly remember those things, she'll get some of the points. Because this is very easy to be diagnosed in the lab. The reason is all these pathogens is resistant for special or sensitive for special antibiotics is novel biosyn, and this one is resistant to it. So if you put all the testing for novel biosyn, Staphylococcus saprophyticus is resistant to that. It's a very quick test that you can do. And it is a sexual transmitted disease for the sexual activity woman at 25, 27 years old. Okay, next one. I want to talk about the Staphylococcus aureus. We want to spend a little bit of time to talk about this guy. Because these things not really happen too much. Staphylococcus aureus. Okay, we want to talk about three things with this guy. Number one, this is called food intoxication. Related to chicken salad. Little bit of my major, which is food safety. Chicken salads is very cheap. $3, $5 sometimes. When you buy that, you will see sometimes the preparing people, especially in the November, December, or January, they're sneezing. So they do like this. They do like that all the time. And the Staphylococcus aureus certainly could be in the nasal tract. And if they did not wear the gloves to preparing the food, the chicken salads, it will be certainly infected or contaminated with the chicken salads. And if you eat it, the onset time is only 6 hours, which means 6 hours you have vomiting, diarrhea, or even nausea. So chicken salads is a risk for the Staphylococcus aureus. It's called a food intoxication. The toxin is present there, even if you cook a little bit. Of course, chicken salads you eat as a raw. So that's the first one. The second thing is we call MRSA. This is some of you heard about that, called methicillin resistant Staphylococcus aureus. So methicillin is an advanced manufactured format of penicillin. So you know penicillin is antibiotics, can cure gram-positive and also gram-negative bacteria. But in the history, we developed lots of generations of the penicillin. They all become antibiotic resistant. In a certain time, we have a methicillin created. Try to solve the antibiotic resistant issue. However, it's not only did not diminish that, it's become even worse because we are using too much, and also it's a hospital acquired infectious disease. We gave them a terminology called nosocomial infection. It's a hospital acquired disease, and the reason is carelessness. So when we talk about Staphylococcus aureus, MRSA is one of the topics. Number three, what we're going to talk about is this guy. Toxic shock syndrome. Toxic shock syndrome, toxin 1. This happened in the history. Is in 1970s. A company called Riley created this terrible tampon for women using in period of time. It is highly absorbent. So what happened is, in the vagina tract, we had a normal bacteria. For example, lactic acid bacteria, to maintaining the lower pH, also to prevent the pathogen growth. The company have this Riley tampons, highly absorbent. All the moisture is gone. The lactic acid bacteria is killed. But then, Staphylococcus aureus is dominant. And then they start to grow and started to penetrate and the multiplication. And what happened is, if you have, this is your liver, let's say, okay, or kidney. Normally, we have this blood goes there. And if you have a toxic shock toxin, what means a shock? It's a little coma. Because the blood pressure is not enough. There is not enough blood to go to the liver or go to the kidney, and these start to decay. But finally, could be because people dying. If you go look at the history, in 1970s, this company's tampons has been killed. 17 women passed away because of they using this. So this one has been out of the market by the time. But when they created these products, they think it's very creative because it's highly absorbent to take out all the moisture during the period of time. But however, it caused a big problem, especially the toxic shock syndromes. That's why Staphylococcus aureus have a third topic is TSST1, which is toxic shock syndrome. That is related to Staphylococcus aureus. Okay, so we say these things are very simple. We say Staphylococcus aureus, we have a food intoxication. It is a food intoxicated pathogen related to the chicken salads. It is also, we talk about the MRSA, related to the hospital-acquired infection because of the carelessness. It is also in the history related to the toxic shock toxin. Staphylococcus epidermis, usually it's a normal bacteria. Staphylococcus saprophyticus is a sexual activity, it's a sexual transmitted disease. It's called a honeymoon bacteria. But clinically, how we differentiate that, it is very interesting. So I can draw a conclusion table for you, how we differentiate that. A clinical area can do a very quick identification. Okay, so let's talk about that. We have Staphylococcus aureus. We have Staphylococcus saprophyticus. And we have Staphylococcus epidermis. Okay, the first thing first, we're using a very special medium. I didn't teach you in the lecture, but you get a question for your exam 1. Remember mannitol, salt, agar. Mannitol, salt, agar. You have that question in your exam 1. Some of you get it. Some of you just guess. This agar is a differentiated media because of mannitol. If mannitol fermentation positive, it is yellow color. Otherwise, it's original pink color. So, we have these 3 different types of the Staphylococcus. On the mannitol salt agar, of course they all grow. Because Staphylococcus aureus is resistant to the salt. But other bacteria will be susceptible to the salt. So remember, salt is a natural existing antimicrobial, although we don't realize that too much. In the food products, we only remember it's very salty, only the taste, but it's antimicrobial. What happened is, if we grow them onto mannitol salt agar, it's very easy to know which one is Staphylococcus aureus, because it's yellow color. The others are pink color, or original color. So that's the first thing first. Second thing, we can use in blood agar. What the blood agar looking for? The alpha hemolytic, beta hemolytic, and gamma hemolytic. Staphylococcus aureus is beta hemolytic. So you will see a transparent zone, and the Staphylococcus alpha-fidicus, this is usually gamma hemolytic, which means nothing happens, and this is also gamma hemolytic. So that's a blood agar we can do. The last one is very interesting. You see the words here called coagulants. So what this means, coagulants? Coagulate or coagulase test. This is the study, very funny is that we're using a tube. We add rabbit blood. Then we inoculate it with these bacteria. We put them, and we testing coagulants. What means coagulant? Blood clotting. Or blood will be glued. So when you add these bacteria there, you flip it over, you will see some of the pathogen among those three will not let it forth. Which means here looks like they're glued. The liquid is glued. That's called coagulants. Now which one? Staphylococcus aureus, and these are negative. So that's number one. What else we can do? The other things what we can do, I just said a joke, is novel vaccine. You can say this is a very simple antibiotics. We say susceptible. That's susceptible. This is resistant. That's the key. That's why the honeymoon bacteria is very easy, can be diagnosed. So this is certainly a very simple table, which concludes the Staphylococcus aureus, epidermis, and the saprophyticus. In a very simple table, can know those characteristics and how we differentiate there in the clinical area. It is very interesting to know about these things because that's related to our everyday life. Sometimes when you have a Staphylococcus aureus, you go to see a doctor, most of the time they can do a rapid testing to diagnose it. Okay? That is MRSA. Methicillin-resistant Staphylococcus aureus. We'll talk about the MRSA real quick next week. Okay, once we finish these, our first section is done. Then we move to next section. Our next section, we will be, by the way, I will be started to put the reading material for you to read and take a look after class and during the exams. You can use those material. It is very important. You don't have to remember, you can just read over it. It certainly helps to understanding all these passages. And these passages is a very typical, important infectious disease in the history. Although some of them we don't really care about too much right now, but it's still existing somehow here and there. Second one. So we talk about upper respiratory tract right here. Then we go to here, is digestion. Human digestive tract. It's not a anatomy class, you don't have to remember, but we need to know several things. Oral cavity, we already mentioned, streptococcus there. Esophagus, liver, stomach, small intestinal, large intestinal. First of all, we need to know the bacteria in our digestive tract. It is part of our center. It's very important, the central system. It is as important as our brain and the heart. Some new research has been showing the normal digestive tract microorganism or microbial community play a much important role for everything in our body. The tons of research has been verified. Let's talk about their components of the bacteria. First of all, our stomach area, the bacteria is very few. Less than 100 cells per ml. That's a concentration. Why? Because stomach, the pH is very low, 1 to 2. The natural acid in our stomach killing the bacteria. You feel about it if you have a heartburn early in the morning. You see something coming back from your stomach to your mouth, you're feeling about, it's acid, it's very acid. That's stomach. Second, intestinal. The bacterial population started to increase. It's about 10,000 cells per ml. Not that much. But when you go to the large intestinal, which means right here, that's huge. The population is more than 10 to the power of 12 cells per gram. And most of that are anaerobic bacteria. Look at our fecal sample, which is the feces. Our poop sample, you can know, although we have a residue of the foods, the water, 1/3 of that are bacteria cells. So it's a very popular research in recent 20 years. If we get a human fecal sample, we're using 16S RNA technology. You may have heard about this biotechnology. We will do our normal intestinal bacteria community analysis. In the old time, we using like DGGE, those technology. Right now, if we get a single colony, we can go whole genome sequencing. But I just want to let you know, our fecal sample is very variable for the bacterial analysis. Especially majority of those are anaerobic bacteria. So it's a very interesting topic. This is the slides listed a gastrointestinal disease caused by food poisoning bacteria. Here, we want to introduce you a very simple topic, which means food intoxication versus food infection. Okay, what does this tell us? Food intoxication, you are eating toxin. Food infection, you are eating bacteria. Which one easy to solve the problem? This is easy. Because as long as I kill the bacteria, I solve the problem. And the common method is heating. If I heated the food products, the bacteria will be killed. This is a trouble. Because those toxin is exotoxin. Usually it's heat resistant. And that is heat liable. The pathogen what we talk and we mentioned and we will talk later on, like a Listeria monocytogenes, like E. coli 0157H7, like Salmonella or Campylobacter, those are food infection. Think about you have a beef. You cook it to well done. You kill everything. And the chicken products, you cook it, you roast it, you killed everything. But like chicken salads, it's not really because the toxin is there. That's called exotoxin. Even you heat it, if it's contaminated with Staphylococcus aureus, it's still there. That is food intoxication. So heating may not solve the problem. Here we listed some of the example with food intoxication. Staphylococcus aureus is one of that. The time of the onset is 1 to 6 hours. Nausea, vomiting, diarrhea, that's very typical for foodborne pathogen. Second one, Clostridium botulinum. We're going to talk Clostridium real quick. Onset time 18-26 hours, 36 hours. You have double vision, swelling, dizziness. It's a little bit of neurological symptoms. Bacillus cereus, it's an endospore-forming bacteria. 1 to 12 hours could have a vomiting, abdomen pain, diarrhea, nausea. All these are usually it's in the rice. This will be the example for food intoxication. Zadis tells us if you buy a bowl of rice from Panda Express, the leftover, you don't keep it on your dorm, the bench for a couple of days and use microwave to reheating. It could cause a problem because the toxin will not be killed. If you use microwave like reheating like 2 minutes, seems like it's warmed up, it's not really. So that's important for these things. But if you have a beef contaminated with E. coli 157H7, yes, you can cook it. And I tell you what are the products usually like that? Hot dog. 90% of the hot dog in the supermarkets, which is contaminated beef or ground beef, they cooked become ready to eat products like a hot dog. We'll talk about that later. So hot dog is not a healthy food. It's also not a very safe food. Be honest with you, lots of the time it's coming from those contaminated or we call it adulterated meat products. Further, they cook to well done or cook to ready to eat meat. Let's talk about Clostridium. We have lots of information we could talk, and this is really related to your life. Clostridium is also a big topic right here in West Virginia because we do the canning a lot. Okay, Clostridium. Clostridium. Let's just write SPP, okay? So, what is Clostridium? Clostridium is gram-positive. Rods, endospore-forming. This is going to give you trouble. Most of the bacteria we already talked, they are non-endospore-forming. This is endospore-forming. Plus, strictly anaerobic. Okay, talk about anaerobic. Why it is anaerobic? There is no catalase, and there is no SOD, sulfite dust mutase, could hydrolyze, become this guy. There's no SOD. that is a problem for these two. We will mention 4 different types of the Clostridium before we end of the class. Clostridium botulinum. This will cause botulism. Okay, let's talk about 3 things. If we talk about botulinum, what we talk about? Number 1 is wound botulinum. Botulism, what we say. Look at here. You have a cuts, you have a bites and abrasions. If you contaminate it with Clostridium botulinum, it looks like that. So this is from cuts, from bites. Decayed metal tools, scissors, knife, very easy to have wound botulism. Because the wound area, think about this. You have this cut. This is basically anaerobic environments, limited amount of the oxygen. So, wound botulism could cause. Number 2, infant botulism. So remember one sentence for the joke. Never feed less than 1-year-old baby honey, because otherwise you may have floppy baby. You have the baby looks like that. The muscle is completely relaxing. Why? Because botulism toxin prevents the neurotransmitter to control the muscle contraction. That's why you get a floppy baby like that. Why less than 1-year-old baby? Their normal bacteria of the intestinal has not been established. You put the honey, you feed them with honey. Honey is a high sugar product. It's a good cultivation for bacteria, for Clostridium to grow. And also, it's very sticky, so it is an anaerobic environment, perfectly substrate for Clostridium botulinum to grow. So that's called the infant botulism. Number 3 is food botulism. What is that? Canned food. Okay, first of all, you more or less see some of the canned food. It looks like that. Put the corns, put the pickles, put the potatoes, put tomatoes, all kinds of things. You can do all kinds of canning. Canned food, it is a little bit tricky. We categorize those into low acid food. So what it means by low acid foods? Water activity around 0.85, pH above 4.6. It is a perfect environment for endosmall bacteria to grow. The reason is water activity is 0.85. Lots of the bacteria already killed. They cannot survive. I give you a very easy example. Listeria monocytogenes can grow the hot dog very well because hot dogs water activity is very high. The beef jerky doesn't see much Listeria growth. Beef jerky is water activity 0.90, and this is even lower than that. So low acid foods doesn't have lots of the bacterial growth because low water activity. pH 4.6, that's low acid. Lots of the, remember, what is the best pH for bacteria to grow? Around 7. 4.6, slightly acid, lots of the bacteria will be killed. So that's a low acid foods. So how we do? We can do several things. Number 1, obviously is pH control. The only regulation by the Department of Agriculture at West Virginia for the canning is pH less than 4.0. That is called operational limits, not called critical control points limits, not called critical limits. In order to do that, what we need to do, canned foods, if you eat it, it's very acid. So we add lemon juice sometimes. We add vinegar sometimes, or lemon concentrate. We lower down the pH. Second time, lots of the times we want to keep it natural. So what we do, those vegetables we only do blanching, which means boiling 2 minutes, or immerse into the 100 degrees Celsius water for 2 minutes, but doesn't work very well. We need to do pressure cooker, 15 psi, 101 degrees Celsius for 15 minutes. Sometimes not that high, but 15 psi is important to kill the indoor smoke. So that's something we need to know. It is important. The pressure cooker, certainly it helps. So Clostridium botulinum, Clostridium tetanus. This guy, I don't want to talk, we don't need to talk too much. What is that one? We had a vaccine, Clostridium tetanus. Clostridium tetanus, usually coming from the wound tube. If you do not have this vaccine, it's very easy to be penetrated. And later on what happened is like the guy there, called lock jaw. The muscle is completely contracted, no relaxing. That's floppy baby, no contraction, all relaxing by Clostridium botulinum. This is Clostridium tetanus. Completely muscle contraction, no relaxing. Why? Because of this. Our neurotransmitter control muscle contraction and relaxing using different neurotransmitter. For muscle contraction, it is always acetylcholine. For muscle relaxing is glycine. And you can see the botulism toxin is blocks acetylcholine. So there's no contract, the muscle is always relaxing. Vice versa, for tetanus toxin, they blocks releasing of the glycine. So what happened? The muscle is always contracts and no relaxing. They are contradicted, honestly, with each other. So, for botulism and tetanus, all those toxins, if we really have a treatment, you need to do antitoxin immediately before we do antibiotics. For botulism, which one we have in the United States? The toxin is A, B, C, D, E, F. B is for the fish products. If we have, by any chance, you have a botulism, you have to call the CDC. The nurse will call the CDC. The CDC will be calling airport. In the south of the United States is Atlanta Airport. They will shipping anti-equine botulism toxin. Why we say anti-equine? Because they are coming from the horse blood to enrichment to get to antitoxin. You have to do this immediately before you kill bacteria, because neutralizer toxin is number one for that. Here, we talk about this already, antibiotic therapy and treatment with antitoxin. Okay. Next one. Clostridium perfringens. So we talk about tetanus, we talk about botulism, we're going to talk about Clostridium perfringens. Clostridium perfringens will cause a severe symptom, looks like the picture. Gas gangrene. What will happen usually for Clostridium perfringens? You put the food products in this dangerous temperature zone. Very easy. 40 to 140 degrees Fahrenheit is a dangerous temperature zone. You should avoid that. Especially close to 140. The mild heat killing all the normal bacteria, let Clostridium perfringens dominant. This is transferred to 50 degrees Celsius. You like Fahrenheit, I like degrees Celsius. Clostridium perfringens usually is for those type of food products, especially like long time, low temperature heating. Let's say you use Swiss-wide cooking methods, 8 hours, 50 degrees Celsius. Very possible have Clostridium perfringens contaminated, because most of those foods we have carrots, beef. Beef give you a good environment. Carrots come from soil, tomato coming from the soil. Soil is a good reservoir for Clostridium perfringens. This one is very easy to diagnose, lots of the time. They have double beta hemolytic zone on blood agar, which means on the very red blood agar, you will see a double transparent zone. So very easy to be diagnosed. That's gas gangrene. Last one. Clostridium difficile. Okay, this is a little tricky one. Clostridium difficile happen is for older people, more than 70-year-old patient with very intensive antibiotic use. So, for example, you use penicillin for more than 7 days, had a fever, nausea, maybe slightly neurological symptoms, but when we look at the colon area, you see the picture looks like that. It's called pseudomembrane colitis. Dead blood cell surrounded. Pseudomembrane colitis. Usually, it's a hospital-acquired disease. This is also we call nosocomial infection. So, in the hospital, if people are using antibiotics dramatically, intensively, we get a colon sample, take some of them using PCR methods to testing the toxin. We can do that. Certainly, immediately we know the results. How we should do the treatment. Number one, very ironic. Although this pathogen this disease is caused by intensive using antibiotics. We could use another antibiotics. For example, if you're using intensively for penicillin, we could use vancomycin as alternative. Why? We're going to talk next week, baby. Vancomycin and the penicillin, the targets of their attacking is different. This is for the cell wall breach system. This is for the amino acid sequencing. It's a little bit different. That's vancomycin. Second, if it's a mild symptoms, we could do drinking lactic acid products. Let's say yogurt. Well, those are medical yogurt. It's not the yogurt you buy in the grocery store. Because we want to put the normal bacteria back. So think about it. If the people has been using penicillin for about a week, lots of the bacteria already died. Then let the Clostridium difficile, we call it a CDIF, to dominant. So we want to put lactic acid bacteria, a beneficial bacteria, back to the colon area. So put normal bacteria back. That's one of the way you can do. If it's very severe, what are we going to do? Fecal transplant. This is terrible. Which means you got to borrow the poop from other people and then put in your body. Because the idea is that we want to establish the normal bacteria into the colon immediately to let the normal bacterial flora is established for Clostridium difficile to prevent. Okay, so this is what we have for Clostridium. It's very important. We want to do using slides to do some of the conclusion. First of all, why Clostridium is tough? Because it's an endospore forming bacteria. It's anaerobic. Once you have an endospore, naturally it's resistant to the harsh environments. Clostridium botulism, we talk about water botulism, infant botulism, and food botulism. Clostridium tetani, we talk about lockjaw, but we have a vaccine for that called the DTaP. Clostridium perfringens is called gas gangrene. The reason is when we prepare the food, right in the dangerous temperature zone, a double beta hemolytic zone, the blood agar can diagnose it. Clostridium the difficile coccidial membrane colitis. This is a hospital-acquired disease, so we call it a nosocomial disease because we are using antibiotics way too intensive. The severe situation, we have to do fecal transplant. Okay, so this is all we have. We'll start from here on Thursday.